Hey folks, it's Samuel Huber from SamuelHuber.net, Samuel Huber on Facebook, Samuel Huber on YouTube, Huber Family Adventures on Instagram, and I'm here with another episode of Heroes of Autism. We have Nikki back from last week, or the week before, a recent guest, and we talked a bit about parenting while on the spectrum. And then my wife had the brilliant idea, like, what was it like to be on the spectrum and being pregnant? Like, and that's what we're here to talk to Nikki about, her experience going through pregnancy. And I guess let's start with what was like finding out for the first time that you were pregnant.
When I first found out I was pregnant the first ever time, I was really happy actually. I mean, I was 17, so I was quite young. So there was a little bit of issue, I suppose, with age, but I suppose culturally, for being a Romani gypsy, that wasn't old, like, if that makes sense. Like, we have our children quite young, so in my sort of culture that wasn't an issue, but like, you know, majority of people would obviously see 17 as a very young age to obviously have your first child. But you know, I was so I was happy and my family were happy about it. There wasn't really an issue. Yeah, so it was kind of okay. Like, it was a happy time, but yeah.
I'm glad you had such a positive reaction, because usually, at least in America, at 17, we freak out when our children get pregnant.
Oh yeah, but the thing is, it's like culturally, so my parents were okay. My parents were okay with it because, you know, having you know, my sister had her first child at 16, and my mom had her first child at 17 as well. So it's not really a it's not really necessarily issue for us culturally. Like, we get married and we have children from like a very young age, so family wise there wasn't really a much issue. It was more like society sort of looked down on me for being a young parent, more than sort of family had an issue with it.
Right. And last time I talked to you, we talked about those societal pressures on being a parent. How did you deal with being 17 and pregnant, and all those people being like wagging their finger or rolling their eyes at you?
I found it really difficult because I felt like, so I'll give you an example. Like, when I was in hospital and I had my son in hospital, there was me and two other women in the hospital, in the ward. There was a young girl who was 15, there was me at 17, and then there was a woman in her 30s who was in there. I was probably the most competent of mothers in that ward at that time. Like, I ended up supporting both the 30-year-old woman and the 15-year-old girl, even though, like, I was 17 at myself, because the 30-year-old woman ended up giving her baby a rash where she did not pre-wash the baby clothes. So it's something that even in her 30s, being a first-time mum, she was unaware that that's what you needed to do. So she'd literally taken the clothes out of the packet and put them on her child, which, you know, gave the child a rash. It was something that I was aware of and had done. So it made me realize that age doesn't really matter. Being a first-time mum and who you have around you matters, because that sort of advice is something that is passed down from mother to mother and, you know, from woman to woman. And if you don't have that support network around you as a first-time mum, you're going to struggle no matter what age you are. So for me, my age didn't really matter, but I saw that people felt that they could take advantage of my age and felt that I was less aware of the world, if that makes sense. So I felt like they took advantage of thinking that I had the lack of knowledge and know-how, when and that I didn't really know how to necessarily fight for my rights, if that makes sense.
Advocate for yourself, basically.
Yeah, exactly. And I didn't know how the system works, and obviously being autistic, we struggle with that
Mm,
anyway. Do you know what I mean? So I
yeah.
think as autistic women, it doesn't really matter what age you are. I think that that people will still see you childlike, and that you don't know how to advocate or what you want, and may try to bulldoze you into doing what they want to do, rather than necessarily what you know is best for you.
Mm. Yeah, and I think that's definitely the thing that all autistic people experience, men and women, that like because we're neuro different or whatever you want to call it, we're like kind of treated like with like kid gloves.
Yes, exactly. So that's a huge issue when you have that mix and you being a first time parent, so like a first time mother. So this is the first time you're going through pregnancy. This is the first time you're experiencing all this stuff. And it kind of like is double fold, because like as a new parent, you don't really know these things either, but then at the same time these people will take advantage necessarily that you're autistic, so they kind of treat you childlike. So I would say for any woman, but especially for autistic women, is it's really important during pregnancy to research and know your rights as a woman, what you're entitled to, and really plan out what you want to happen and stick to that. Make sure you assert the fact that this is what you want, and don't really let anybody bulldoze you into taking a different path, or being uncomfortable.
I definitely hear that, Nikki. What she's saying, guys, is just using your executive functioning skills and make your decisions for yourself before you give birth. That way, you just focus on that experience. Because I'm watching my wife go through it with our son. Like it's an ordeal in itself just to give birth. So like, on that day, you should just be focused on that rather than what was my plan. uh, what rights do I have? Like, I agree. Like, definitely researching beforehand is definitely key, because then the doctors will be like, "Oh, I can make decisions for you and your baby," without you being like, "What? No, it's not what I wanted."
Yeah, exactly. And I'm not saying that all doctors are like that, but it's something that we need to be aware of, that like a lot of times some doctors will take advantage of ignorance, and you
Mm-hmm.
know um the advice is something that will be for their agenda and what their opinion is of what you should be doing. So I'm not saying don't take advice from like midwives or anything like that, or doctors. um but we have to realize, in the medical field we do have choices with our treatment, and we do have the choice to like second opinions, and we don't always have to do what a doctor says, and they have to give us every sort of scenario, and then we make up our minds. We don't have to do what they say. And a lot of the time that's what will be thrown at you, is that it's their way or not. And the thing is over here in the UK, because we have the NHS, so our healthcare is completely and utterly free. So we, depending on what area you're in, your maternity sort of ward can be very busy,
Mm-hmm.
and midwives can be very busy, and they could have several women that they're looking after.
Mm-hmm.
So a lot of the time they will want to try and push you into doing what is convenient for them rather than convenient to you, and they will try and make you feel like you're being obnoxious by sort of demanding something else. So it's something that I would have to say as well, like, don't feel guilty for fighting for something that you're entitled to. And here in the UK especially, like with the NHS, like, yes, we're grateful for the healthcare and stuff like that, but you know, we have to, you know, we're allowed, we have these rights, and the NHS have to toe this line, and the midwives have to do have to keep to what you suggest in your birth plan and these sort of things. So, you know, don't feel guilty about these things, because that's one thing that I regret through my pregnancies and my births, is that I didn't have this information and I didn't fight, and I had really horrendous time.
Each time, or just the first time?
Each time. The birth for my second child was actually okay. It was the aftercare of the birth that was the issue. But generally, through all three of my pregnancies, I've had an horrendous time.
Because you didn't know that you had these rights.
I think, yeah, and because I didn't realize that I had these rights, and I think it was just generally with me being autistic. I felt like I couldn't challenge the authority of the doctors and the midwives. Like, I kind of would shrink back, and for me, my births were very, very difficult from a sensory point of view, as well as, like, you know, obviously giving birth is very difficult and very painful, like for every woman. But I think being autistic, so okay, I'll give an example. For me, as an autistic person, when I'm in pain, I like to pace up and down. It helps me deal with the sensation of pain. So I like to pace up and down. It's something how I get to self-regulate, not get out of control, because sometimes when I'm in pain, it can cause me to have a meltdown if I'm unable to self-regulate myself. So when I was giving birth, each and every time I was put on a heart monitor, and this monitor meant that I was strapped to a machine, and that meant that I was strapped to a bed, and I was unable to get up and pace up and down, which meant that my labor was slowed down, and it meant that I was not able to self-regulate, and then when I became overwhelmed, and when I came to the point of meltdown, the midwives then treated me as if I was like unreasonable and like sort of attention seeking and stuff like that. So, you know, I would get a lot of tutting and like sort of dirty looks, and you know, and telling me to stop being such a baby and shut up and things like that, you know. So the way that the midwife spoke to me during my labors were like quite horrible as well, you know. So I never felt supported by a midwife in any of my pregnancies. So going into labor, like, which is a scary time for women, because our lives are literally on the line at that point. To not trust the people that are supposed to be taking care of you is really anxiety driven, you know. So I went in with a lot of anxiety and had anxiety through all of my labors, which made things worse. It made it an horrendous time, rather than like, I wouldn't say birth is necessarily like a happy time, but you know, once the baby's there, it's a happy time. But
right. I remember that. Yeah.
But yeah, it could have been made a lot easier and smoother and a better time for me, just generally, if I felt like my needs were taken into account, if that makes sense.
It makes sense. Having gone through that with my wife to a certain extent, like, because my son was born premature, so we had to go through all these things that we weren't expecting, that weren't part of our birthing plan. So I totally get where you're coming from, and it's really interesting to hear it from your perspective, because I'm a man. I'm never going to have actually had that experience. So I think the big things you've hit so far: be well informed, and I'm so sorry that you went through that with your midwives. I can't believe they said that crap to you.
Yeah, I mean, to be honest, like I said, my second son's birth was the only one that was actually really positive. My first birth was horrendous. It actually put me off of children altogether. And my second son actually was conceived through failed contraception. So my first birth was actually like really horrendous, and it completely put me off of children and pregnancy and everything. I found it really difficult right from the beginning to the end of my pregnancy. I found it I want to say that like I am really grateful for my children. I'm really grateful for the fact that I'm able to get pregnant. I have no infertility issues. I am grateful that every time I've had a pregnancy, I've had a healthy child at the end of it. I just want to make that clear. But for me, being pregnant was horrendous. Like it felt like a parasite had taken over my body. It was like suddenly there was this somebody else controlling my body, and that was difficult for me to deal with. So right from the beginning, I had really bad morning sickness. So, and I from a sensory point of view, I hate throwing up. I know nobody likes throwing up, but from a sensory point of view, like it really, like vomiting really distresses me. So I had really bad morning sickness to the point that like a lot of the time I couldn't eat. As soon as I would eat something, it would come right back up. Sometimes even when I drank something, it would come back up. And this lasted for the first 4 months of my pregnancy. And on top of that, it's being tired. So suddenly being like overly tired all the time, like used to really frustrate me, because I'm like, I still wanted to have the same level of energy and do what I usually did during the day. And then I was all of a sudden really tired. I enjoyed feeling the baby move, and I enjoyed feeling the kicks, as it meant that my child was alive and healthy. But from a sensory point of view, like it was really difficult to deal with. Like for me, they were like really frustrating and annoying, because I think generally I have an issue with touch anyway, so I don't really like people touching me unless like I'm aware and wanting you to touch me. So kicks were like somebody constantly poking you, you know, like, and there's nothing you can do to stop this person from poking you. Like it's inside you, there's nothing you can do. And it was times like, you know, the baby would have his foot in my hip or like under my ribs, and you know, and just generally feeling uncomfortable, not being able to sleep. You know, at the end of all 3 of my pregnancies, I was up day and night. I couldn't sleep at all, and my mental health was quite bad. I was really quite low in mood, and I just spent all the time crying, just praying for an end to it. And when I tried to express that to my midwife that I was struggling so much, do you know what I mean? It was like I was always given this kind of speech and rhetoric that, like, you know, every woman is fed up at the end of their pregnancy. You're just going to have to deal with it, you know, and we're not going to do anything to help you. I also had physical issues during my pregnancy. So I had a condition where basically the hormones make your pelvis soft. and basically my pelvis was moving around because I have a condition called I can't say it, Ehlers-Danlos syndrome. EDS. So basically I have a collagen issue. So basically my pelvis was moving around a lot, and I could it made it very difficult for me to walk, and you know, my pelvis was like grinding a lot of the time, and you know, it was out of place, and basically I was in a lot of pain, and there's not much that they could do for me. I mean, there was pregnancy physio that I went to, but it didn't really help a lot, and they can give you painkillers, but I refused to take painkillers while I was pregnant, especially strong painkillers. That was a personal choice that I chose to do, that I was like, you know, I know that they say that you can drink when you're pregnant. I'm zero tolerance. I don't drink at all while I'm pregnant or breastfeeding or anything like that, you know. So again, like the only thing that I would take was paracetamol, which I think is Tylenol in America. And that's all I would take, and that really didn't make a difference to the pain. So by the time then eventually I did come to giving birth, I mean, so for my first son, I actually went into early labor at 30 weeks with him. And I actually got to the point of 5 centimeters dilated, which is established labor. My midwife's or the consultant, and I heard the consultant literally say that he believed I was lying. I was actually in the bathroom with my mum, which was opposite the midwife office, and I literally heard him say that he didn't think that I was in labor and that I was faking it, even though I was 5 centimeters dilated. It got to the point where there was an incubator warming up in the room. I had the midwives from the neonatal come up and speak to me, ask me, can we do this? You know, I had to sign papers, you know, about, you know, talking about different injections and stuff like that that they could give to the baby, you know. And so it was a really, really anxious and tense time. And basically the midwife went on break, and I had a temporary agency midwife come in, and on my notes it said no internal examinations. She decided to do an internal examination, and her hand actually went far into my pelvis, and she told me that she could feel my son's head, and that his hand was on his head like this. This is what she said, and I was screaming my head off in pain. And she actually pushed my son. So my son actually ended up like coming up to right underneath my ribs, and it somehow stopped my labor, and I was hospitalized for a further 6 weeks, and he was actually born at 36 weeks. So that's classed as premature, but obviously not extremely premature. And I had steroid injections and things like that, and the whole time, you know, I was accused of not being in labor and lying about everything, even though I was dilating, and that I was like 5 centimeters dilated, and that on the monitor it was picking up my contractions. And I think it was because of how I deal with pain. I can be in an extreme amount of pain, and I can say, and I would probably be the same way that I am now, and I'll say to you, you know, I'm in pain. I need some painkillers. and people go, okay, well, if you're in pain, you'd be like crying and flailing around, you know. So it's the way that I sort of communicate how much pain I'm in, and that people, you know, the midwives and doctors really didn't take me seriously with the pain that I was in. On top of that, I do feel like it was racial discrimination, because here in the UK, being Romani Gypsy is like, it's an acceptable form of racism towards us. Everybody does it. Everybody feels like it's unacceptable to do that. So we face a lot of prejudice and discrimination in the healthcare. So I think on top of my ethnicity and being autistic, I think those things combined it into having such a horrendous time. But I do definitely feel that I wasn't taken as seriously because of how I communicate as an autistic person and how I sort of express pain. And that my sensory needs weren't taken into account either. And a lot of the time, midwives were dismissive of me. And I found it really difficult to, in that moment, to advocate for myself. Like, I'm tired. I'm tired. I'm exhausted. Exactly. I mean, my last pregnancy, my youngest son, his labor was 33 hours. I was in labor for 33 hours. Yeah. And I hadn't had any sleep in that 33 hours as well. So for me, I'm exhausted. I am tired. I've been through all this pain, you know, a lot of the time, like, so, you know, my pain relief through all of the pregnancies was gas and air. So all I had was like laughing gas, basically. Through all 3 of the pregnancies, that's all I had as pain relief. And it's because it's the only thing that I feel like I can cope with. So I'm not very good at dealing with painkillers, if that makes sense.
That makes sense. My wife doesn't like them either.
Yeah. No, and so the thing is with gas and air, it's like you get an instant high, but that high also goes the instant you stop taking it, if that makes sense.
Yeah.
So to me, that's the only sort of pain relief I had. So once I stopped taking it, all that pain relief had sort of gone anyway. There wasn't any lasting pain relief. So I'm just tired. I'm exhausted. You know, you then you've got a baby to look after. So in that moment, I really needed the people who were supposed to look after me to look after me. But I felt like that didn't happen, that all sort of fell through. And I was kind of dismissed. So for me, I just wanted to go home. Like, I was like, I want to go home. I want to be in my safe space and how I feel comfortable. I just don't want to be in hospital at all. So for me, because my first son, he came early, I wasn't allowed to have a home birth with my second child. And then with my third child, because I had a lot of physical medical needs, it just wasn't even an option at all. Like, it was hospital and that's it. So I think if I could look back, and if I could have had what I wanted, I probably would have gone from a home birth, because that's an environment that you can control. And it's something that you can have things around you that are yours and can comfort you. You can have your STEM toys there, you know, you can have all these things that like help you self-regulate in an environment that is comfortable to you, because hospital environments, I mean, like, you've got You got fluorescent lighting, do you know what I mean? The beds are uncomfortable, like scratchy material. Like, it is, a hospital is like a sensory overwhelming place. Like, the one thing that I found like really overwhelming as well is that I could hear other women screaming giving birth, you know.
Oh, Jesus.
So, you know, imagine you're in this situation and it's like, it's bright and like you're scared and you're anxious, and then you've got all these sensory, and like things are scratchy because, you know, and the floor sticky, and then you've got women screaming. It was just like, for me, it was like really sensory overwhelming, and it made things really difficult. So I think if I was in my own environment where I knew that I was safe and I was happy, and that I could, you know, walk around and self-regulate how I wanted to, then I think I would have had a lot easier and better births. So it's something that I really think that autistic women really need to take into account, is like, make sure that you are secure, because you know, giving birth is hard anyway without all those sort of added stuff that will make things so much worse.
Yeah, and if you have to go to the hospital, I would say definitely pack like a sensory bag, like with all your sensory toys and needs. So you can bring a bit of home with you, so you have that comfort. Would that think have helped you if you had to, like, pack the bag with your toys?
Yeah, definitely. You know, like I said, if I had to go, like if you have to go to hospital, you know, and it's somewhere that you want to choose to go as well, because obviously this is a choice. You know, if that's where you feel comfortable is in giving birth is in a hospital, then yeah, I would definitely suggest like making sure that accommodations are made with you and taking sensory toys with you. So if it's a matter of like dimming down lights in the room, you know, having certain sensory things around you, you know, even to like you know, medication, all those sort of stuff are your choices. These are things that you don't have to have, you know. Everything is a choice and needs your permission. So don't ever feel forced into doing things. And, you know, like, definitely, you know, for me, as an autistic person, you know, how I self-regulate is moving up and down, like pacing up and down, you know, flapping, things like that, you know. Whatever you need to do to self-regulate when you are in like an anxious place, you do it. Whether that's like take stim toys with you, make sure that like someone lets you move around and say, hey, like, you know, I understand you need to monitor the baby's heartbeat. Is there another way? Because the midwives do have handheld heartbeat monitors, that so they can leave you to move around. It's not necessarily that they need to put you on the machine. It's basically, well, I don't know why it's like in America, but here in the UK, a lot of the time they want to put you on this machine because they can see it from a computer screen.
Yeah, we have that in America.
Yeah. So then it's basically them being, it's convenient for them, right? Because you're on this machine, they can trace your contractions, can trace baby's heartbeat, and they can be off doing other things, and this computer can track you, right? But here in the UK, and I don't know about in the US, but I know here in the UK there is a heart monitor that they can do, which isn't around your stomach and allows you to still move about. And it's basically they stick this this heart monitor, they stick inside you and put on the baby's head. So it's able to do that same reading. So yes, you have a tube connected to you, basically, because it's on the baby's head, but you're able to move around and don't need to be stuck onto a bed. And like I said, they do have the handheld thing that just means that the midwife has to come in and actually take it with the handheld thing. So they will be reluctant to do that, because obviously that means that their workload is a bit more, you know, and that you need their attention. But it's something that they're supposed to do as part of their job, you know. The monitor, computer monitor, is basically there as a convenience for them, not for you. So if it's more convenient for you to be up and moving around as an autistic person, then fight for that right. It is your right, you know. And it's more that they will have an attitude, if anything, it's because it's not convenient for them. But remember, it's you and your body and your experience and what you're going through. And the thing is, as a mother, we got to realize as well that if we are not comfortable, if we're not happy, like, it will prolong your labor. It will mean that the baby can then become distressed as well. And then it becomes an emergency. So if you're not happy as a mother giving birth, the baby's not happy giving birth. Do you see what I mean?
I see what you mean.
So it's really important that we need to make sure that we're happy and comfortable and feel safe, you know, and we're okay to speak up about those things. It's like going back to pregnancy. You know, I really struggled through pregnancy, and I found it really difficult as a sensory thing. But you know, a lot of people will put the pressure on you that, like, if you express that necessarily you're not having a great time, people will like gaslight you and say, well, you know, there are women out there who can't have a baby, and you know, there are people who struggle to have a baby and can't carry their own baby, and think about all those people. So you get a lot of gaslighting as well when you don't enjoy the pregnancy. And I found it really difficult. Again, it was like, from a sensory point of view, I don't like people touching me. So to suddenly go to antenatal appointments where they were measuring me, taking blood pressure, touching my belly, you know, all those things were like really difficult for me to deal with, because I really don't like people touching me. And again, it was like, a lot of the time they just are like, they're in their head and have a checklist as to what they need to do. So they don't sit and think about asking your permission, or like telling you, I'm going to touch you now. So I would say,
it just sounds like they don't treat you like you're even human. You're just kind of like something they can poke at.
Yeah, basically. And that's what it kind of felt like to me. Like, you know, like I was a bit like cattle, like, you know, going through on a conveyor belt, going through the motions, like in, out, you know, this is what we want to do. Even when I had specialist midwifery care, you know, I felt at the time I was able to talk about the anxieties and everything that I felt. I made a plan and was given promises, to the point with my last pregnancy, I had specialist antenatal care because of my physical medical needs and disabilities. And so I went through antenatal specialist care. So I went to a specialist clinic, saw specialist midwives, who did take more time to hear my concerns and stuff like that. And then there was promises that because of my disability, I was concerned that when I gave birth, and it had to be in the hospital, that I wouldn't have somebody to help me to take care of my son, because I need care, and my husband is my carer. That I felt like, because of my disabilities, I wouldn't be able, if left alone, to be able to take care of my son efficiently. So it was things like, I was concerned that I wouldn't be able to like get up and pick him up out of the cot to feed him and things like that. So I was given the promises that my son, that we would be in the side room, because here in the UK, dads are there during the birth, but afterwards, when you're in hospital, sort of in the sort of like antenatal, like postnatal care afterwards.
Mm-hmm.
Dads are only allowed at visiting time, and you're kind of stuck on a ward, so you're allowed to have like 6 beds in like a room,
Mm-hmm.
with like, you know, just curtains around you. And so I was told that, you know, we would be in a side room, and that my husband would be able to stay with me to help me, because the midwives would be busy and wouldn't be able to like give me the care that I needed.
Mm-hmm.
So I was promised all this would be in place. When I actually gave birth and was taken up to the maternity ward, I realized very quickly all of that had fallen apart, and that wasn't going to happen, and I was going to be stuck on a ward. It's to the point that I have mobility aids. So at the time it would mean being in a wheelchair. So we're talking about, you know, I walk with a walking frame and use a wheelchair.
Mm-hmm.
So I was like, how am I going to have a wheelchair and be able to wheel myself around when I'm exhausted? I've just been in 33 hours of labor. You know, a midwife's not going to be able to take me to the toilet and bring me back. You know, things like that. This is what I needed my husband's care for. So I realized that all of that had fallen apart. So we ended up, I paid privately on the NHS. So to get the care that I was, so to be able to have my husband there and to care for me and to care for my son, all this stuff that was promised to me and was my right to have fell apart, and I ended up having to pay privately. So to get that support as a disabled person, I had to pay £150 for it, you know.
Wow.
So, you know, I had to pay for a private room in an NHS hospital. So it's, so it all kind of fell apart at that point. And you know, I had a lot of medical issues. My son had medical issues. He ended up having to go into neonatal, you know. So luckily enough, like my husband was there and was with me and was able to go down to neonatal with him, because I wasn't able to. You know, it would have meant that my son was in neonatal by himself without any parent, you know, if he wasn't able to be there with me. So it meant, like, you know, feeding during night times and stuff like that. You know, my husband was able to help me. So I know that, like, I'm not saying that my experience is what every woman in the UK experienced, because I feel like generally I was probably unlucky all 3 times, you know.
Yeah, it sounds like it. It's like you're definitely a hero in my book. Every mother is like, but to go through it 3 times and not get what you want, it amazes me you were willing to do it 3 times.
Oh, I know. I mean, like, that's why I said my second son was a surprise, a happy surprise, and I, but my third son, I actively planned him, made sure that, because I had like physical needs and disabilities at that point, you know, I really made sure that I had things in place. And these things were put in place, but it all fell apart as soon as I gave birth. And I wished that during my labor, I had insisted more and was like, you know, this is what's supposed to happen. Like, no, can I speak to a manager? So here in the UK, we have something called PALS, which is basically, they are an advocacy department. So they advocate, like, so they know what your rights are as a patient. So they'll advocate on your behalf as a patient to make sure that the doctors and everything are like doing what they're supposed to do. So I wish that at the time I had got PALS involved and really fought for my rights, but it's really difficult at that point when you are tired, and you've just given birth, you know, that it is important, I think, for partners to be clued up on the rights of, so they can advocate on behalf of the woman giving birth.
That was gonna be my next question. How was your husband through all three of these pregnancies?
Well, the first one, he was useless. we were 17, and like he was, yeah, completely and utterly useless at that point. Like, I think more than anything, I wanted to kill him. That's what I mean. He got very used to the fact that I get very angry, like when I'm like giving birth. I don't like anybody to touch me. Like, I will, like, if you came anywhere near me. So a lot of other women will, like, you know, want flannels dabbed on their head, or a back rub, or a feet rub, and things like that. I'm like, don't touch me, don't come anywhere near me, because I will literally kill you. Like, I'm like, stay away. And I can get very overwhelmed in that moment. So in my generally, when I was like pushing, you know, I needed that sharp reality. So sometimes, like, you know, I think my last pregnancy was my last birth was probably the funniest. My husband, actually, I was pushing, and my husband had me in a headlock. And I know that sounds terrible, but he had me in a headlock because I needed to focus in that moment, because, like, you know, I was being overwhelmed, and I needed that like snap back, that reality, like, you have a job to do, you know. So I needed him to do that, and it was basically, it started off as him just like being face to face with me, and like getting me to focus, and sort of encouragement, and sort of just like holding me, and then as I was pushing, it sort of developed into a headlock. So you know, I'm pushing and he's got me in a headlock, but it was like something that, you know, I very much needed him. We were he had his forehead on my forehead, you know, something that really focused and encouraged me. And it's something that, you know, I definitely needed, because at that point I was getting really overwhelmed, and like, you know, just didn't want to push and whatever. Do you know what I mean? I was like going into like sort of in hysteria, if that makes sense.
Yeah, it makes sense, because like it sounds like your husband gave you was like deep pressure therapy by hugging you that way.
Yes.
Which, for folks who don't know, for autistic people, that helps us focus, to like get like a really close hug, or you know, someone putting their hands on either side of our face and squeezing it. And that's like, your husband was not trying to kill her. You're just giving her deep pressure therapy, even though he, you know, like that's what you need to focus in that moment, or else you get too caught up in your head. And after watching my wife go through my son's pregnancy, I'm like, I put myself in her shoes, I would probably react the same way, just like, you know, acting like the way you did. So it sounds like quite an experience. What tips do you have for moms who are pregnant? Like, what helps with your morning sickness?
So, they say ginger helps, but I didn't really like ginger. Generally what helped with me is that I ate ice lollies, because with ice lollies, it's you're able to have fluids, but like slowly. So like when you're drinking, you can, you know, unless, like, even when you're sipping, it can be too much and like trigger you to vomit. Whereas like an ice lolly is a bit like, or sucking on ice or something like that, you know, so you're still getting the fluid and the moisture, but like slowly enough that you just really just like making sure that you are eating that you're having something sweet as well, because you're going to need sugars. Make sure you don't get dehydrated, but really generally, like, depending on your level of morning sickness, there's nothing really you can do. I mean, if your morning sickness is really severe, they do have medication to help with that. But generally, it's something that you just need to be able to handle, and different women have different degrees of it. So for me, there was not really much that helped to stop me vomit, but I just needed to make sure that I stayed hydrated. And ice lollies and ice poles and crunching on ice, you know, made that possible. The thing is with ice lollies is like you're getting that fluid and the sugar at the same time. So that was kind of helpful. But yeah, generally it's like, I mean, for me, when through my pregnancies, I'm really smell sensitive anyway. So certain smells just heightened my idea of like throwing up, you know. So it got to the point that I was like a little bit like, had a smell that was tolerable for me, and I would put it on like a scarf or something like that. And when I would encounter a smell that was like too much for me and might actually make me vomit, it was like I'd put that sort of scarf or something, you know, over my nose, so it was like more of a tolerable smell to kind of mask that bad smell. So that's something that possibly could help to stop you vomiting. But generally there's not much. I mean, there's old wives' tales like ginger and things like that you can always try. For some people it works, for some people it doesn't. But generally there's not much you can do, I'm afraid.
Yeah, I do like the smell idea because it gives you something else to concentrate other than the actual vomiting, I assume. Like, as I've talked about on my channel, like smell for autistic people is how we can like establish trust within an environment and like helps us self-regulate our bodies, which is really cool. You're able to figure that out. That you just carry that scarf. So, do you have any advice for the partners of these first-time autistic mothers? Like, what if you could like control your husband through your pregnancies? What would you have him do to comfort you as an autistic woman giving birth?
I think definitely understanding what your, you know, the autistic person wants, needs, and how they like sensory wise. Like I said, for me, being all like lovey-dovey and stuff like that, like a touching me would drive me crazy. But there are times, like you said, when I need deep pressure. And when I'm feeling overwhelmed, that's what I want. I do want that deep pressure, like squeezing and things like that. So knowing what helps your autistic partner definitely is something that I would suggest and give advice to, like, know what actually supports them and what doesn't. And generally, like, I think for me, it's like, it's understanding that this isn't about you, even though like you're having feelings and, you know, the pregnancy is hard, and as dad you go through your own stuff, like realizing that, you know, this isn't about you, and maybe some of her behavior towards you isn't personal. It may be hormonal, it may be that they are struggling, do you know what I mean? And sometimes like you just gotta, when she's yelling at you, you just gotta shut up, you know, like shut up, don't argue back, you know, because she might be yelling at you and the next minute she's crying and she wants a hug, you know.
Right.
Sort of your partner, the woman, is going through so much with the pregnancy and everything else, you know, their body is changing, they've got all these things going on. So, you know, and you got to realize that this is your child as well, you know. So as she's going through all this stuff so that you can have your child, you've got to, you know, deal with the hormones a bit. That's your part to play in the pregnancy. Does that make sense? That, like,
definitely.
you know, that so don't get so upset and take things like personally. You know, this isn't about you, it's about, you know, what they're going through. That's not to say I'm invalidating any you know, anybody's feelings, you know, the supportive partner's feelings. I'm not invalidating that or dismissing that, but generally, like, women, you know, if you want to be supportive to your partner, like, I understand that things aren't personal, you know, try not to feed the fire when they're, you know, hormonal and upset, you know, because it can be very difficult. I found that one thing that my husband did is that when I was emotional and upset, he would point out the logical obvious. So, you know, like, if I'm like, I just want this baby out now, he'll be like, you can't, you've got this many weeks to go. And you know what I mean? Like, and it's like, that doesn't help. Like,
there's a fact, that empathy.
yeah, exactly. Just the empathy of going, like, this is really hard, you know. And, you know, to just being supportive like that, and, you know, really sort of saying, you know, your feelings are valid, your experience is valid, you know, because we're told in, you know, especially as women, in the media and all these pregnancy books, and even like your family or whatever around you will be like, oh my God, isn't this a great and happy time? And it is, but it's also very difficult. And there's a lot of things going on within your body, and, you know, not sleeping and things like that. And sometimes you can feel guilty for feeling these ways, or feeling like that you're abnormal because you're not enjoying it, or that you are struggling with these things. And essentially that every woman is different, and everybody experiences different pregnancy different. Every pregnancy is different. So just because you've been pregnant before doesn't mean you're not gonna encounter different experiences in other pregnancies as well. So it's realizing that it's a personal journey for everybody. So there is no right or wrong way to feel about pregnancy and how you're feeling. So it's sort of getting the partners to understand that, and help encourage the woman to sort of think that way. Do you know what I mean? And say, you know, you're valid in feeling this way, you know, and it's okay, and like, come for them, you know, if they want a McDonald's burger at 3 o'clock in the morning, go get them a McDonald's burger, you know.
Right.
It's you know, things like that. That's how you can really be supportive. And like I said, in birth, the biggest thing in birth is, like, you know, sitting with your partner, really figuring out a birth plan, what the partner wants, what the woman wants giving birth, and really know as a partner what that plan is, because the woman is going to be busy giving birth. Like, you need to be the advocate for them in that moment. So it's, you need to necessarily be the one to challenge the midwife, rather than leaving that to the woman, you know. And be like, actually, this was what was on our birth plan, this is what she wants, this is what she needs, and sticking by that. You be the advocate, and really, yeah, just sort of in that moment, sort of trying to read off. And I know that this is very hard for autistic people, is to really, like, try and figure out the body language, or figure out a way you and your partner could communicate, even like non-verbally, that you can understand, you know. So so for my husband, there are certain, like, he can pick up off my body language when I'm not happy, or I'm not distressed, or, like I said, in that moment, he knew that I needed that kind of deep pressure, and I needed that. And I mean, like, so he's, like I said, he's virtually got me in a headlock, you know, that the midwife wasn't exactly happy about that, you know. So it's knowing that, like, between the two of you, really to being understanding and really knowing what the partner needs, what she might need in that moment. And sometimes that can mean like not verbal communication, like she might not be able to actually say to you like, I need this and this right now. So I know that that's very difficult for autistic people to do, to sit up, like pick up that micro sort of body language signals. And it's why definitely to talk before then and go, you know, this, if I'm behaving like this, or if I'm giving off this signal, like this is what this means, you know, and really communicate beforehand.
Yeah, like tapping your nose means put me in a headlock.
Yeah.
Something like that.
Yeah, like
That's
when I'm
something.
quiet, I'm going, oh, I don't want to do this anymore. Like, put me in a headlock.
Yeah, I think that's definitely the part, is talking to your partner, having also, I would also have like all your needs like on a sheet, so you're not afraid of forgetting what your wife needs as she's going through pregnancy. You'd also hand that to the midwife too, so like everyone's clear on what mommy needs.
Yes,
Um,
exactly.
so, what was it like after giving birth? Like, okay, the kids are home now. Like, what was it like adapting to um, having a little bundle of joy at home, and then 2, and then 3?
Oh, it was quite, it was difficult because I think the tiredness, like of, so I breastfed with all 3 of my children. So sole feeding times was solely on me. So it meant that like I was getting up and feeding them. So I was like feeding them all for the day and night. So that was quite exhausting. And then from like a sensory point of view, like your body's gone through so much, you know, and you've got all these hormones flying about now that make your moods all strange and all over the place. And I think everybody at that point wants to come around and see the baby. And everybody wants to come around and see the baby and see you. Well, not really you, but yeah, the baby.
You get a pat on the head at most.
Yeah. So I would say, like, you know, if family members are going to come, really lean on that moment and say, can you bring me a meal, you know, a ready-made meal that my husband can necessarily like, or my partner can stick into a microwave or the oven quickly, you know. Can you come and, you know, while you're here, can you want to see the baby anyway, you don't really want to see me, so can you look after the baby while I go take a nap, you know, things like that. You know, really, like, don't be afraid to ask things from support and things from other people, because, you know, having a baby, especially a newborn baby, can be very difficult, and while these people are here, like, take advantage of that, and ask them to do things that are generally going to help you. I found it really, I found it very difficult in regards to advice from midwives, because you see midwives for a while. I think it's like the first week or 2 here, and then you see a health visitor, and they stay with you until the child is 2 years old. And I found it very difficult taking their advice, so I would take things literally. And sometimes I was confused, so don't be afraid to say, actually, I'm confused, can you explain it in a way that I understand? And I think definitely, if you are feeling, because everyone, like, person feels blue. Over here we call it the baby blues. So it's when you feel really sad after giving birth. Like every person goes through that. But for some women, obviously, that can develop into postnatal depression. So for me, I would definitely suggest being okay with saying I'm struggling, you know, say I'm struggling with this and I'm struggling with that, and being honest about that doesn't make you a bad mum. It doesn't mean that you're failing being a mum. Because, you know, everything is different. I mean, my last son, he was born with laryngomalacia, which is a floppy larynx, and it's an airway defect. And I was breastfeeding him at the time, and I was really struggling to breastfeed him because ultimately he couldn't breathe while he was feeding. But I didn't know this at the time, you know, and I kept all this struggle and this feeling to myself, you know. And then it ended up, I really had a huge, I ended up having blocked milk ducts. We developed thrush, so I was basically passing thrush back and forth. Like, so every time I fed my son, he was giving it to me, and then I was giving it back to him. So like, even though we were on like medication, and I felt like, because I was such an advocate for breastfeeding, that I felt like by failing to breastfeed or to struggle to breastfeed myself, that that I was failing, if that makes sense, that I was a hypocrite. Because how can I champion breastfeed and then say it's like really great, and then I struggle to even do it myself and feed my son. So I kept these feelings within myself, and they sort of developed into postnatal depression, you know. So I suffered with postnatal depression with my first son and my last son, and in that moment, you know, you're feeling like you're failing and whatever, but it's really important to feel okay to be able to speak out about it. You know, and these midwives or health visitors, like antenatal, like postnatal care, is there to help you. And if you are struggling and you do have postnatal depression, it doesn't mean that you're a bad mom or you failed at it, you know, because we are fed this impression, especially even once the baby's here, that, like, you know, it's a happy time and everybody has things fine, do you know what I mean? And everything is perfect and got to be perfect, otherwise you've sort of failed. And then that's not the case. Like, I feel like every woman, no matter, like for me, going from 1 child to 2 child to 3 children, you know, actually juggling the lives of other children make things difficult, make having a new baby difficult. Because especially, you know, the advice you get is like, when baby's asleep, you sleep. You can't necessarily do that if you have other children, because they're not asleep, you know. So it does make things difficult. So the more children you do have, I definitely would say lean on people around you, and family members to support you. And if you don't have necessarily family members to support you, you might be a single parent or away from your family, you know, or have estranged relationships with your family, you know, really lean on health visitors and that sort of postnatal sort of service, and really talk to them and open up about how you're feeling, and that you are struggling, and because that's what they're there for. That's their job. And you are not encountering anything that like plenty of other women around the world are struggling with, you know. You are not abnormal in how you're feeling. So I would definitely say that is really important, is to know when to reach out and to say, you know, I'm not feeling great. And because especially with postnatal depression, like for me, I mean, it's definitely when you hear about in the media, it's about the fact that, you know, you hate your child or potentially could hurt your child. For me, my postnatal depression wasn't like that. I became obsessed with my child and felt like I had to do everything myself, wouldn't let anybody come near, and became obsessed with everything being perfect. So, you know, I would have baby in one arm, the pushchair in the other, you know, wouldn't let anybody do anything for me. I had to be immaculate at every stage. So I never felt the need to hurt my son, but I became you know, it's to the point that people would come to visit and I wouldn't let them hold my child, or like even if I did, it was only for a short time, and then I was like giving them back to me. You know, I became obsessive about doing everything myself, and so it isn't always necessarily that you hate your child and that you're struggling, you know. It can mean that like you become obsessive with everything being perfect and hitting a sort of ideal of what motherhood needs to be. But even if you do feel like if you feel like you're struggling to bond with your baby, and that you are, you know, feeling anger and stuff like that towards your child, definitely speak to somebody like a midwife or something like that, you know, speak to somebody, because it doesn't necessarily mean that you failed as a mum or anything like that. You know, it's postnatal is hormonal based, and that you can get help, and yeah, and it doesn't necessarily mean that you can't develop a bond with your child or that you don't love your child. You know, none of those things matter. So I do want to talk, I know I've gone on a bit about how you feel in postnatally, and I think it's generally because it's a very important thing. You know, I feel like many women have probably gone through postnatal depression and not had support, and probably have not spoken out about it. And I think as autistic people, I think it's definitely important, because I think as autistics we can take things literally. We can take this advice literally, and we definitely like miss out on like social cues and social things that happen, you know.
Right.
And it can mean that sometimes we can feel very isolated, you know.
Yeah, and also I imagine like you start believing that voice in your head that says you are a bad mom, but you can't tell that this isn't a real feeling. You like just because you are autistic, you took your thought literally
mm.
as truth. From what I'm hearing, what you're saying, was that true for you? Like you were having trouble breastfeeding your third son, like you just took it what your thought is. This must be the truth.
Oh yes, yeah. And I think as autistic people, like a lot of time, which you probably can identify, is that people treat us like childlike, in that we need support, and we are, you know, unintelligent and don't really need, you know. So if you're an autistic mother and you're struggling, you know, that can feel as if like those people are valid, you know, in thinking that you that as an autistic person you can't cope, or that you are childlike, that you need more severe support than you need. And it can invalidate that with all in your head, and that's not necessarily true, because all women, anybody who gives birth and has a new baby needs support. And depending on the level of support that they get, you know, it's all depending on their circumstances. So just because you're autistic doesn't mean that you necessarily will need support, but it also doesn't mean that you're a bad parent because you need support. Does that make sense?
Yeah, it makes sense. I think every mother, regardless if she's autistic or not, should get that support, because as you know, you've gone through, Nikki, and that I think any parent's gone through, is like a little extra help would have just made that transition so much easier. And understanding that it is a lot to bring a human being into this world, and there are aftershock effects of it, like postpartum. How are you able to, I guess, climb out of that hole that postpartum often puts women through?
I think for me, I was definitely working on my mental health, and just sort of gentle sort of support, being there. Especially my husband was a huge support during that time, in sort of helping me to realize that actually, like, I was a good mom. And I think for me, as an autistic person, because I'm very logic based, like, I needed him to give me examples. I didn't need him to turn around and say, oh, you're a good mom, because that's not what I believed at the time. So it's things like, oh, you're such a good mom because you do this for the child, or like, you're a good mom because, or look how he looks at you, look how he goes to you, look how amazing and wonderful you are, look, really have somebody sort of say to you all the positives that counteract the negative that is in your head. I would definitely, like I said, get support and help from medical people if you're feeling really low. I will always say that, don't try and do things yourself, because, talking therapy is a medication they're all fine to take, but generally, definitely having somebody sort of support you, just really think about thought patterns that you're having, express yourself. Like, definitely, like, sitting there and having somebody to say, like, I'm really struggling and this is really hard, and I didn't realize this was going to be so hard, and really having that sort of cry and like really verbalizing like how you're feeling really helps. Like, bottling it up doesn't help. Like, really talking about it, whether that's with a therapist or with a partner, really express yourselves and really get all these feelings out is the best way to sort of deal with postnatal depression. And also realize that, there's no time frame in regards to getting over postnatal depression. So, science says that it roughly takes about 2 years for a woman's body to get back to like normal after having a baby. So you're talking about 2 years worth of hormones still raging around, and you going through all different things as a parent through those first 2 years as well. So, your life has changed, you're encountering obstacles and things like that, and your body's still getting back to normal. So it's also giving yourself time, like, mentally, to be able to heal as well, and really realizing that, there's no real time frame around your mental health. Even though, like services here in the UK, there will always be a time limit on it. Really take time in yourself to have somebody that you trust or whatever to express yourself is definitely, and just realize that it's okay, even if you don't have somebody to turn around and say to you, oh, you're doing this really well. Maybe even actively do that yourself. Go look at all the things and go, what did I achieve today? My child is fed, my child is happy, they were asleep, they were able to sleep, I was able to get them dressed today, things like that. Like, really sit down and take note of all the things that you were able to do today. Oh, we were able to go to the park today. I took my child to the park. We played today, you know. Really break it down and focus on those things that you are doing as a good mum. And definitely I would say, you know, everybody has an opinion about parenthood and having a baby and pregnancy and everything like that. Like, realize that like everything is like personal, and you know, it's your journey and how you feel, and there's no right or wrong way to do things. I mean, obviously there's a wrong way to do things. I mean, you know, we're not like child abuse and stuff like that, that's obviously wrong. But I mean, like in regards to, you know, if you feed your baby formula, like that's okay, you know. If you breastfeed your child, that's okay, you know. Those are the things that I'm talking about. Like, you know, you're not necessarily failed if you've gone to breastfeed and you weren't able to achieve that and you've ended up formula feeding. That's okay, that's not a failure, you know. That's okay. The best thing about that is your baby fed and happy and healthy? Yes, you know. So it's things like that. People have an opinion to say, oh, you know, breastfeeding is bad or breastfeeding is best, or do you know what I mean? It's like everybody has an opinion. So it's things like that, you know. Oh, do you use disposable nappies? Well, I think in America you call them diapers. Or do you use reusable ones, you know? Do you use the organic food? Do you use baby food that comes in a tin, you know, or a jar? Or are you home making food and blending it up? You know, those are things that I'm saying, it's like it's personal to you and your child, and what is suitable for your life, you know. And that's what I'm saying, is there's no right and wrong way in doing things. You have to say, you know, yeah, there will be people that will say, you know, homemade food is better, you know, and you need to do that. That's not always viable for everybody, you know. So don't feel bad and don't feel like a failure, because that's what you're having to do. And it's all personal to you and how you're feeling, and what is best for you and your family. So definitely take some advice, but take it all with like a pinch of salt, you know. Because
you have that bond with your child, and like that bond is something that no one else has. You'll know what your child needs.
oh yeah,
and if you don't, your body will give you signals. So from what I understand, for women, they can like sense like the baby's hormones changing and stuff and stuff like that. And just looking at your child, you spend all day with your baby, you know when they're hungry or tired or hungry again.
yeah, exactly. I mean, and even with the medical professionals, I mean, a lot of the time they will give you advice and stuff like that. I mean, here in the UK, when I had my second son, here in the UK, there was a whole drive about obesity. And my son weighed in at 3 months old. He weighed in a little over what was average. I mean, it was minuscule, you know. And the doctor told me I needed to put my son on a diet.
Oh, geez.
At 3 months old. And I sort of went as a parent, like, you know, yeah, all right, I'm putting my 3 months, you know, child on a diet, you know. And he wasn't obese. Like, his weight the next time he was weighed was normal, and I didn't do anything. I stayed on the routine. So, you know, it's things like that. Like, sometimes you have to use your intuition and your own sort of common sense into knowing what's right and what's wrong for your child, you know. I mean, my first son, he was huge, absolutely huge. He was fat. He was like, he was really fat. He was a chunky baby. I mean, he was born at 36 weeks and was 8 pounds, so he was huge. And he was massive. until he started walking. When he turned a year old, and he just like lost it all, and he's like skinny and is still skinny to this day, you know. So it's things like that. Like, people will always have something to say. You know, I had doctors was like, oh, he's too fat, but then like in a health visitor would be like, he's fine, he's just got a healthy weight on him, you know. So it's things like that, you know, don't always. But like I said, I became obsessed with, like, and that's the thing with I found as an autistic person, it's like that I can become obsessed with what is right, you know, like it has to be on a level, and it has to be routine, and any change in that routine is like really difficult for me to deal with. So it's like I sometimes become obsessed with that, and sometimes, you know, kids don't really work out that way, and there can be different changes and stuff like that. And it's, even though having a routine is definitely helpful as a new parent, you know, you got to be okay with letting that go. And I know as autistics that's very hard for us to do, is like accepting that change, and accepting that there may be things like, you know, like, so for me it would be an instance where like I would plan to go out for the day, say I needed to go shopping, so I had planned everything out, even to like the time scale, you know. So I would be like, oh well, I'm going shopping at 12 o'clock, you know, and to me I have to literally be out the door and shopping at 12 o'clock. With a newborn baby, like there was plenty of times where I'd be going to go out the door at 12 o'clock and they needed a nappy change, you know.
Right.
So it's kind of like, yeah, and then it's like, you know, and then they've got like poo everywhere, so then you need to change the clothes, you know, and give them a bath and everything like that, you know. So it's understanding and being able to learn to deal with those sort of changes and be okay with that, is definitely something that takes practice and takes time, and it's something that you definitely have to be kind to yourself about learning as an autistic person.
Definitely. And I think that's the huge key, is like, while we do love our routines, like once you have a kid, like, be a little loose and give yourself several choices. Like, I could be out of here by noon, or I could be out here by 12:30. Either way is okay. I still have the choice to leave, and it gives you that time to change their diaper or nappy. So this is a lot of great info. I definitely learned a lot about pregnancy that I'm definitely going to use it next time me and my wife experience it. And I hope for all of the other Aspie girls out there who are thinking about becoming pregnant, or are, like, this helps you out. Again, you can ask questions here on the YouTube, or you can contact Nikki at what's your website and Instagram again?
Autistic Life in Motion.
Yeah, and I think you'd be happy to answer any questions for first-time moms who are on the spectrum, because like, that was a lot of info. I'm sure there's gonna be 1.5 million questions coming our way about this. But Nikki, thank you so much for being incredibly vulnerable today with me, and like sharing such, I think, very honest response to my questions. Because the way me and my wife went through this, everyone's like, it's gonna be fine, you know, like they kind of painted it up all nice, but then you actually go through it, and there's so much more to giving birth on for either autistic dad or mom or whoever. It's just a big experience, and I just really appreciate you being vulnerable with me today, and being vulnerable to my audience and sharing your story, your crazy stories. And I commend you. You know, as a mom, like, all moms are superheroes because they go through something like this, what Nikki went through. Anyway, Nikki, is there anything you want to say to the young moms out there before I let you go?
Yeah, I think my main sort of focus is that, like, it's all your personal journey, and like, and that, you know, that, like I said, there's no right or wrong way to be pregnant or to feel during pregnancy, or to give birth or to feel after you've given birth as well. There is no right and wrong way to feel. Definitely, if you at any point, prenatal or postnatal, feel any depression or suicidal thoughts or whatever, don't be afraid to speak out. These are perfectly normal things that women face, is prenatal and postnatal depression. And that even some women, after having a baby, can end up having psychosis. These are all things that are perfectly normal in the nature of pregnancy and giving birth. So nothing means that you have failed or anything like that. But definitely speak out if you are having any of these feelings. That's the most important thing to do, is to be able to speak out and seek help. It doesn't necessarily mean that you have failed, or that that you're going to affect your child or anything like that. And that you are still a mom, and a good mom, and that actually, like, reaching out and seeking help actually makes you a good mom, because you realize that you're struggling and you're wanting to do what's best for your child. So actually reaching out makes you, in a way, a good mom, because you're trying to make sure you're healthy for your child, so that you can be the 100% the person your child needs. So definitely reach out. It's all personal. Like, don't worry if, like, pregnancy isn't a bed of roses for you, or like birth or anything like that. It's all personal. And it's not also, there's no right and wrong way. And I think definitely for me is researching and understanding your rights during your pregnancy and birth, and really standing by that, and definitely make a birth plan that your midwife and your partner are aware of, and sort of stick to that.
All right, Nikki, that was excellent advice. Basically, know yourself, mamas, and know what you need, and know your rights. That's the biggest thing from what I took away from your stories, Nikki. And also, just take care of yourself and advocate for what you need. Advocacy is just the key to victory, as I like to say.
Yes.
All right, Nikki, thank you so much for coming on my show today. We're gonna hopefully have Nikki on a panel very soon that I'm starting with several other autistic adults, and we're gonna be swapping more stories and giving more advice out there. That announcement will be coming shortly. Until then, Nikki, it was nice seeing you.
Yes, thank you for having me again.
Yeah.